So over the last 24 hours, we have tested 87 persons, and of the 87 persons tested, we have 2 positives. We currently have 71 persons who we are tracking for COVID-19, and we have 6 persons now in the hospital. And right now, because we are tracking 71 cases, this is a major increase from over the last 3 days. We have also seen increases in the hospital from 0 to now having 6 persons in hospital. And of the 6 that are in hospital, we have 3 persons in the ICU, with one of those persons being intubated. So the point here is that COVID is not over. I know a lot of people would want to think so, but we are now having increase in cases despite low levels of testing. Well, they should get the booster dose. That's very important. And if they're going to be going out in crowded areas, then they have to start re-wearing masks, especially if we're going to see an increase in cases. Then the best way to protect yourself is to start wearing an N95 mask and of course get boosted. So these are simple measures that one can take, and it's your personal responsibility. There are many home kits that are now available, and so persons might have these kits, they use them at home, they test themselves, and if they're positive, they don't report to us. And that has been a problem because we can't validate or verify whether these persons are positive or not. Some people might use that to stay away from work. Others might very well be positive and they're doing the right thing by staying away. But the ministry cannot validate that unless you come to one of our testing sites where we can test people. If persons test positive with a kit, then we'll have to, it would be good if they share that with us, and so that we can at least have the numbers of positives. As I've said before, the clinical presentation now of COVID is very closely associated with symptoms of the flu. So you might have persons with runny nose, persons with a cough, itchy throat, and some persons also having fever. These can be easily mistaken for flu, but in fact it might be COVID.